have a box of these vinyl gloves.
Julia MOAK is 16 weeks pregnant and working from home in New York. She's expecting her child in September and keeping a video diary of her life under lockdown. She says she's trying to take enough precaution to protect herself from COVID-19. But she's worried.
I am concerned about how it would affect me being pregnant. And I am also concerned about how it's going to impact the birthing process and also having a newborn.
As hospitals around the world struggle to cope with the rising number of patients, many women are worried about giving birth at a time of a global pandemic.
Potentially I'll be going into labor without like a support person or a family member or doula or a visitor. But then on top of that, delivering in a place that I don't know and with someone I don't know.
The World Health Organization says pregnant women with symptoms should be prioritized for testing. While there is no evidence yet of transmission to the fetus, new mothers who have symptoms are being urged to take precautions.
They should cover their mouth and nose. So remember, they are infectious. They could put the droplets onto the baby. So we don't think they'll transfer it through the breast milk, but you could transfer it through the normal way that everybody else is transferring this virus, through the nose and the mouth. So wear a mask at all times when you're dealing with the baby, and again, be absolutely rigid about washing your hands.
Aid agencies say the pandemic and lockdowns may disrupt access to life-saving sexual and reproductive health services for millions of women worldwide, especially those in poor nations.
The epidemic has impacts on multiple levels, particularly when it comes to access to family planning and safe abortion care. When women don't have access to these services, we see big rises in unplanned pregnancies as well as unsafe abortions. So we can expect to see devastating consequences for women and girls around the world because of this lack of access to reproductive health care services.
Although severely restricted, life hasn't stopped because of this pandemic. But it seems to have made things more difficult for women's health and their well-being. Priyanka Gupta, Al Jazeera.